Good day. My name is Sean Flaherty. It is 2 July 2022, and my presentation today will be on Hashimoto's thyroiditis, or otherwise known as Hashimoto's disease. Hashimoto's disease is a autoimmune disease where the thyroid gland tissue is attacked by the person's immune system. This affects the thyroid's hormone-producing cells, resulting in a decline in hormone production or hypothyroidism. It's not clear what causes the disease. It may be due to genetic factors or environmental factors such as stress or radiation exposure, or it could be the combination of both genetics and environmental factors. The disease can progress slowly over the years, and the decline in hormone production may result in a whole litany of symptoms. Some of them are fatigue, muscle weakness, muscle aches, joint pain, swelling of thyroid, puffy face, depression, just to name a few. Now, some of the risk factors for this disease are women are more likely to get it than men. It can occur at any age. However, people in their middle age have a tendency to get it more than anyone else. Also, having other autoimmune diseases such as diabetes, RA, or SLE could contribute to getting Hashimoto's disease. There seems to be some genetic connections too, so if there's a family history, there's a good chance you could also get Hashimoto's disease. Pregnant women are more prone to it. Also, people that have excessive iodine intake, so that's like intaking too much over iodinized salt, could be too much iodine in drinking water or animal milk rich in iodine, certain seaweeds if you're into that, and iodine containing dietary supplements. Now, if Hashimoto's disease is left untreated, it could lead to several complications. One of them being a goiter, which is an enlarged thyroid, which occurs here. Poor heart functions, so more specifically cardiomegalia and arrhythmias, mental health issues, also sexual dysfunction, so decreased libido in both men and women, also erectile dysfunction in men. Also, it could cause reproductive dysfunction, affect a woman's ovulation, cause menorrhea, and lower sperm count in men. Also can affect pregnancy. So there's an increased risk of miscarriage or preterm birth. It may also affect the child's intellectual capabilities or cause autism. That is my presentation on Hashimoto's disease, and thank you for listening. Hope you have a good day.